Cardiologist warns, never take B12. With these two common medications after 60, to all seniors who are in the habit of taking a vitamin B12 supplement every single morning, please pause for a moment and give this important information your full attention before you take your next dose. Right now, as you're watching this, something very significant is happening within the bodies of millions of older adults across America. What's concerning is that this process doesn't come with any obvious warning signs like pain, dizziness, or chest tightness. Nothing that would immediately make you put down your coffee and reach for the phone to call your doctor. Despite the lack of immediate symptoms, this silent issue is quietly increasing the risk of stroke and heart damage in individuals who are diligently following what they believe to be the best health practices. Vitamin B12, a supplement widely regarded as one of the most dependable and beneficial options on the market, is unexpectedly creating a dangerous situation when it interacts with certain common medications. Here's a crucial piece of information that your doctor may not have shared with you. When high doses of vitamin B12 are combined with one of two very common medications, it triggers the creation of a molecule known as homocysteine. This molecule behaves much like sandpaper, causing wear and tear on the inner lining of your arteries, thereby significantly multiplying your risk of experiencing a stroke. Today, I will be revealing exactly which two medications pose a danger when taken alongside B12 by individuals over the age of 60, and I will provide you with practical steps to safeguard yourself. Before we dive into the details, please take a moment to leave a comment below and let me know where you are watching this from. Also, consider hitting that subscribe button and enabling notifications so you don't miss out on vital health information like this that I share every week. Now, please type your current age into the comments section. Just your age is fine, because the information I'm about to share will resonate differently depending on how long you've been taking these particular medications. Here's something important to understand before we go any deeper. A notable study published in the prestigious Journal of the American Medical Association uncovered a surprising finding. Seniors who consumed high doses of B vitamins, including vitamin B12, over an extended period actually demonstrated an increased risk of cardiovascular issues under specific circumstances when compared to those who took lower doses. Not a decreased risk, but an increased one. This revelation caused quite a stir among many in the medical community. However, once you grasp the underlying biological mechanism, it all becomes quite clear. Let me tell you about Dorothy. Dorothy was a vibrant 71-year-old retired school teacher, as sharp as could be. She maintained an active lifestyle, walking every morning, and took a daily regimen of supplements with her breakfast, believing that after the age of 60, the body's ability to absorb nutrients naturally diminishes. Vitamin B12 was at the very top of her list of essential supplements, and she took pride in her proactive approach to her health. What Dorothy was unaware of was that she had been taking metformin for her type 2 diabetes for nearly 8 years. Throughout those 8 years, no one had ever sat down with her to explain how metformin affects the absorption of B12 over time, or what happens when the body attempts to compensate for this deficiency. Her daughter began to notice that Dorothy seemed more tired than usual over the preceding several months. It wasn't the kind of sleepiness that a good night's rest could fix, but rather a profound exhaustion that lingered. Dorothy herself attributed this fatigue to simply getting older. When her blood work was eventually reviewed, which included her homocysteine levels, the results revealed a pattern that was becoming increasingly common. Her homocysteine levels were alarmingly elevated. Interestingly, her B12 levels appeared high from her supplementation. However, the combination of these two findings painted a clear picture of silent vascular damage that had been accumulating over years, all while Dorothy was diligently doing what she believed was right for her health. If Dorothy's story sounds familiar to you, please comment Dorothy below. Let me now explain in detail precisely what is occurring within the body and why the combination of B12 and these two specific medications creates a problem that standard medical checkups often fail to detect. The first medication we need to discuss is metformin. If you have been diagnosed with type 2 diabetes, there is a very high probability that you are prescribed this medication. It is one of the most widely prescribed drugs in America for managing blood sugar levels, and it is indeed highly effective. However, metformin carries a side effect that most patients are never fully informed about. Over an extended period, particularly after several years of use, metformin interferes with a crucial substance in your gut called intrinsic factor. Intrinsic factor is a protein that your stomach produces and acts as a vital transport mechanism for vitamin B12. You can think of it like a dedicated taxi service. Vitamin B12 gets into this taxi, and the taxi then drives it to where it needs to go within your bloodstream. Metformin silently impairs this essential taxi system, making it less dependable and consistent. Consequently, your doctor might observe low B12 levels and advise you to take a supplement. You then proceed to purchase a high-dose B12 tablet, perhaps believing that more is always better. For a period, your B12 blood levels will rise, and your doctor may express satisfaction that everything appears to be in order. However, here's what those blood levels are not revealing to you. They are not showing what is happening further down the line in your body's processes. When vitamin B12 cannot be properly processed and transported due to the compromised intrinsic factor system, it begins to interact with another molecule in your blood called homocysteine, and it is with homocysteine that the situation becomes genuinely perilous. Homocysteine is an amino acid that your body naturally produces. In small quantities, it is harmless. Your body, with the help of B vitamins, including B12, B6, and folate, typically converts homocysteine into something useful and then clears it from your bloodstream. But when this essential conversion process is disrupted, often because the B12 is not being adequately absorbed or processed, homocysteine starts to build up. Elevated levels of homocysteine in the blood have a very specific and damaging effect. They act like sandpaper on the inner walls of your arteries. If this explanation is helping you understand what's happening in your body, please hit that like button. A research team at Harvard Medical School described this phenomenon vividly. Elevated homocysteine doesn't cause a sudden blockage like a blood clot might. Instead, it causes chronic abrasion. It leads to inflammation of the arterial walls, making them stiff and more susceptible to the formation of plaques. It also hinders the natural expansion and contraction of the blood vessels, which is essential for healthy circulation. Imagine your arteries as flexible rubber hoses. When they are healthy, they expand and contract smoothly with each heartbeat. However, when homocysteine has been scraping those inner walls for months or even years, the hose gradually transforms into something more akin to a rigid plastic pipe, and rigid pipes, as we know, are prone to cracking and breaking under pressure. In the cardiovascular system, such a failure can manifest as a stroke or a cardiac event. Now, I want to ask you to be honest with yourself. How many of you have been taking metformin for more than 3 years and also taking B12 supplements? This combination is present in countless individuals' bodies every single day, and tragically, very few people are making the connection. Let's now turn our attention to the second medication that I need to discuss. This is a drug that an even greater number of people are taking, and its interaction with B12, while different from metformin, can in some ways be even more unpredictable. These are known as proton pump inhibitors, commonly referred to as PPIs. Medications such as omeprazole and pantoprazole fall into this category. They are designed to reduce stomach acid. They are frequently prescribed for issues like acid reflux, damage caused by stomach acid, and for protecting against ulcers. PPIs have become extraordinarily common among seniors, as acid reflux tends to become more prevalent after the age of 60 due to natural changes in the digestive system. However, PPIs have a less discussed effect that most people are not made aware of at the pharmacy counter. They reduce the amount of stomach acid that is crucial for releasing B12 from the food we consume in the first place. Your body requires an acidic environment to break down the protein bonds that hold B12 within food. When you suppress this acid with a PPI over months and years, your ability to absorb dietary B12 drops significantly. A study published in the Annals of Internal Medicine followed more than 25,000 patients who were on long-term PPI therapy. The findings indicated that after 2 years of continuous use, patients taking PPIs showed measurably lower levels of B12 in their blood. Following such a discovery, what is the typical course of action for most doctors? They recommend a B12 supplement, which, on the surface, seems like a logical solution. The problem arises because, in certain individuals, particularly older adults with compromised kidney function, the supplemental B12 is not processed and cleared from the body as efficiently as it should be. This can lead to an accumulation of B12 in the blood in a form that doesn't interact well with the homocysteine cycle we've just discussed. However, here's where things become particularly concerning. Some patients on long-term PPI therapy develop a condition known as rebound acid hypersecretion. This means that when they stop taking the medication, or even as the medication is being processed by their body overnight, their stomach overproduces acid as a compensatory response. During these rebound periods, the high-dose B12 supplement is being processed in a highly unpredictable environment. This erratic absorption leads to erratic management of homocysteine. On some days, the body might successfully clear it, while on other days, it might not. When was the last time your doctor specifically inquired whether you were taking a PPI and a B12 supplement concurrently? Please type "never" in the comments if that's your experience. I want to see how many people this applies to, as I suspect the number will be quite sobering. Now, let's bring together everything we've discussed. The homocysteine connection is truly at the heart of this entire issue. Homocysteine is one of those specific markers that almost never appears on a standard blood panel. Your doctor will likely check your cholesterol, blood sugar, thyroid function, and perhaps even your B12 level itself. However, measuring homocysteine requires a separate specific test that must be explicitly ordered. The Cleveland Clinic has identified elevated homocysteine as a significant and often overlooked risk factor for cardiovascular disease in adults over the age of 60. Yet, it's highly probable that most seniors have never had this particular test performed. Here's why this is so critically important. When your homocysteine levels remain elevated for months and years, 3 detrimental changes occur within your cardiovascular system. Firstly, the inner lining of your arteries becomes inflamed, and its natural smoothness begins to degrade. Secondly, small oxidized particles of LDL cholesterol find it easier to lodge themselves in these inflamed arterial walls, leading to the formation of plaques. Thirdly, and perhaps most critically, the plaques that form in an inflamed environment characterized by high homocysteine are more prone to rupturing unstably. This means they can break off and travel through the bloodstream rather than remaining stationary. This last point is key to understanding strokes in individuals who, upon imaging, show no major blockages. The plaque was present. It was simply unstable and broke loose. Researchers at the Mayo Clinic have observed that elevated homocysteine levels are present in a disproportionately high number of these so-called unexplained strokes. The cause was not a mystery. The appropriate test was simply never performed. This information is not intended to instill undue fear. Rather, it is meant to empower you with knowledge, placing the control back into your hands. And now that you have a clear understanding of what's happening internally, let me tell you what you can actively do about it. The solution is not to cease taking B12 altogether. Vitamin B12 is genuinely essential, particularly for individuals over 60. A deficiency can lead to nerve damage, chronic fatigue, cognitive decline, and yes, even its own set of cardiovascular risks. Therefore, the goal is not less B12, but rather smarter B12 intake. Firstly, if you are currently taking metformin or a PPI, the most crucial step you can take right now is to ask your doctor to test your homocysteine level and your active B12 level. It's not enough to simply measure total B12 in the blood. You need to know the active form that your body can actually utilize. Total B12 can appear normal even when active B12 is low. This distinction is absolutely critical and is often missed by many standard tests. Secondly, the form of B12 you choose makes an enormous difference. Most B12 supplements found on store shelves contain cyanocobalamin. This is the most cost-effective form for manufacturers to produce, but it requires your body to go through several conversion steps before it can be used. For older adults taking metformin or PPIs, these conversion processes are often already compromised. The form known as methylcobalamin, on the other hand, bypasses most of these steps. It is already in an active, usable state. Research published in the European Journal of Clinical Nutrition found that methylcobalamin was more effective at raising functional B12 levels in older adults compared to cyanocobalamin, even at equivalent dosages. Thirdly, the dosage plays a far more significant role than most people realize. High-dose B12 supplements, typically ranging from 1,000 to 5,000 micrograms daily, are widely available and commonly consumed. However, your body can only absorb a small fraction of this amount without adequate intrinsic factor. The remainder floods your bloodstream in a form that can potentially exacerbate the homocysteine imbalance we've discussed. A more targeted dose of 250 to 500 micrograms, taken in the methylcobalamin form and combined with B6 and folate, provides the homocysteine cycle with everything it needs to function optimally without overwhelming the system. Fourthly, engage in a specific conversation with your doctor about your medication list in relation to your supplement regimen. Make this a dedicated agenda item at your next appointment, not a passing question. Clearly state, I want to discuss my B12 supplementation in the context of the medications I am currently taking. That focused conversation alone has the potential to significantly alter the trajectory of your cardiovascular health. Let me share the story of Beverly as it encapsulates the message I want you to carry with you. Beverly was 74 years old and had been taking a PPI for 14 years and supplementing with B12 for the last 5 of those years. Her daughter, having seen a video about homocysteine and heart health, insisted that Beverly accompany her, armed with a printed article. Beverly, understandably, was skeptical. She felt perfectly fine. Her blood pressure was well managed, and she walked her dogs daily. Her homocysteine level came back at 31 micromoles per liter. The safe range is considered to be below 15. At 31, her level was more than double the amount associated with a significantly elevated risk of stroke. And yet she had absolutely no symptoms, no warnings, no inkling of the underlying issue, just a number on a lab report that perfectly explained why her arteries were functioning under unnecessary strain. Her supplement was switched to methylcobalamin. A low-dose supplement of B6 and folate was added to support the homocysteine conversion pathway. Furthermore, her B12 intake was timed strategically away from her PPI dose to maximize absorption. A follow-up homocysteine test was scheduled for 90 days later. When Beverly returned 3 months later, her homocysteine level had dropped to 17. While not yet at the ideal level, it was moving decisively in the right direction. She confided that she hadn't truly realized how fatigued she had been until she started feeling the difference of feeling less tired. If you have been following a regimen similar to this for years, please know that it is not too late. The human body possesses a remarkable capacity for recovery and rebalancing when provided with what it truly needs. The vascular inflammation caused by elevated homocysteine is not permanent if addressed before a major cardiovascular event occurs. Beverly's progress in just 90 days serves as a powerful testament to this. Here is your clear action plan. First, review your medications. Are you currently taking metformin for diabetes or a PPI, such as omeprazole for acid reflux? Second, examine your B12 supplement. What form is it? If the label states cyanocobalamin, you need to transition to methylcobalamin. Third, assess your dosage. If you are taking more than 1,000 micrograms daily, you are likely taking too much. Fourth, schedule a homocysteine test. Call your doctor tomorrow and specifically request a homocysteine level test, along with testing for active B12. Fifth, consider adding B6 and folate support. These nutrients work synergistically with B12 to facilitate the proper processing of homocysteine. What you have learned today is this: metformin and B12 can create a dangerous interaction through the intrinsic factor pathway, leading to elevated homocysteine and arterial damage over time. Proton pump inhibitors reduce the essential acidic environment required for B12 absorption and can create an erratic processing environment that disrupts the homocysteine cycle. Homocysteine is rarely tested on a standard panel, and elevated levels in seniors represent a significant and under-recognized cause of stroke and cardiovascular events. The effective solution involves not stopping B12, but rather switching to methylcobalamin at a smarter dosage, with the added support of B6 and folate. Please comment below and let me know if you are currently taking metformin or a PPI and also taking B12. I am keen to see how many of you this information applies to, and if this video has shed light on a potential danger you were previously unaware of, please share it with any loved ones over 60 who might be taking these medications. Your shared information could, quite literally, save someone from experiencing a stroke. Don't forget to like this video and subscribe for more evidence-based health insights that your doctor may not have the time to convey in a brief appointment. This information is for educational purposes and does not constitute medical advice. Always consult with your healthcare provider before making any changes to your supplement routine, especially if you are currently taking medications. Thank you for entrusting me with your health education today. You now possess knowledge that most people have never been privy to, and this valuable information can benefit those you care about as well. Take good care of your heart, and I look forward to seeing you in the next video.